Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. India was initially seen as a success story for its response to COVID-19. Now, thousands of people are dying in India every day. Hundreds of thousands of new infections are being recorded every day. All ventilators are in use and intensive care units are operating at full capacity. The healthcare system is on the brink of collapse. The same situation is happening in Africa. Africa was seen as initially as a success story with fewer cases and fewer deaths. How worried are you that what we are seeing in India right now may likely happen in Africa? And when can we expect most people in Africa to be fully vaccinated? Thank you.
Thank you very much. I'll hand over to Dr. Maria van Kerkhove.
Yes, so I'll start with the first part of that question. So, Simon, as you've pointed out, the situation in India is really heartbreaking, as the Director General has said, and the exponential growth that we've seen in case numbers is really, truly astonishing. We have seen similar trajectories of increases in transmission in a number of countries. It has not been at the same scale, and it has not had the same level of impact and burden on the healthcare system that we've seen in India, but we have seen similar trajectories where the incidence was almost vertical if you looked at that epi curve. This can happen in a number of countries, in any countries, if we let our guard down. I'm not saying that India has let its guard down, but I'm saying we're in a fragile situation. 9 weeks of case incidence increasing, more than almost 5.7 million cases reported last week, and that is certainly an underestimate of the true number of cases of infections that have occurred in the last week. It's a fragile situation globally, and we really have the elements around the world with a lack of strategic and comprehensive use of public health and social measures for a variety of reasons, some of which because some individuals cannot attain physical distancing, living in very crowded situations, cannot wear proper use of masks because they don't have those masks, or they don't have 3-layer fabric masks, or for a number of reasons of social gatherings taking place. We still need to apply all of these elements of physical distancing as much as we can. Avoiding of mass gatherings, avoiding of crowded spaces, improving ventilation in indoor settings, spending as much time as we can outdoors compared to indoors, and using vaccines as much as we can for frontline workers and those who are most at risk. So the situation is fragile. The situation can grow if we allow it to. And this is why it's important that every single person on the planet knows that they have a role to play. And we need governments to be able to support them in taking the actions that will inform them about what they need to do and keep them safe and make sure that they can actually carry out the measures that are being asked of them in the local situation where they are. So I think you present a situation across India, but also in Africa, as you mentioned. We do need to not let our guard down and really follow through on all of these measures that we can and make sure that governments continue to apply comprehensive approaches, informing, engaging, enabling populations so that they know what they need to do to keep themselves and their loved ones safe.
Thank you very much. Dr. O'Brien, please.
Just the second part of the question, which was about, when would we see full vaccination in Africa? And I think the best answer to that is that the actions that are taken now and in the very near future are going to determine that. Obviously, the critical issue is supply and having adequate supply to serve all people in all countries who need vaccination. There are actions that can be taken now, both through funding from countries, through dose sharing, through increasing manufacturing, which we've talked about before, about what the steps are to rapidly accelerate manufacturing now and in the medium and longer term. And I think the other issue is the importance of equitable distribution of those vaccines. As we've said so many times, there are a large number of doses that are inequitably distributed, and this is not going to result in immunity and vaccination of all countries at the same pace to protect those who are most vulnerable. I think we really have to focus on the healthcare workers now in many countries who do not yet have vaccination access, do not yet have adequate supply in countries. And there are many countries that have started vaccination, but not enough doses to actually give the second dose at this point. So we're in a really critical phase right now of assuring that those at highest risks, healthcare workers, those who are at highest risk of hospitalization and death, are prioritized in all countries around the world. And that means moving supply into countries that have inadequate supply at this point to actually deliver that critical public health benefit.